be made available to all families that have infants or toddlers. And this is called an Individualized Family Service Plan. So instead of an IEP, it's an IFSP. And the parents have a right to participate in the creation of this plan. So typically this will be through Regional Center, and here we have Regional Center of Orange County. So they would help create this plan if they find that a student needs it or a child needs it. And then Section 504 of the Rehabilitation Act of 1973, this is a law that prohibits discrimination against people who do have disabilities in programs that receive federal financial assistance, including schools. And Section 504 defines an individual with handicaps as anyone who has a physical or mental impairment which substantially limits one or more major life activities, has a record of that impairment, or is regarded as having such an impairment. And then students who do not qualify for an IEP, they may be eligible for what's called a 504 plan. And this is just a less official document that accommodates their needs. They won't be getting services such as speech services, but they will have accommodations. For example, if they need more time to complete their assignments, if they need to test in a separate setting, if they have a medical diagnosis of autism or a medical diagnosis of ADHD, but it's not impacting them significantly enough for them to have an IEP, then you can talk to the school about providing a 504 plan. So that's another option. And then as mentioned here, you could have a 504 plan for anxiety, ADHD, or autism if they're not demonstrating significant challenges at school, but they still need some support. And qualifying for a 504 is much easier than qualifying for an IEP. The process is less intensive. Yeah, so the 504 plan is different from an IEP, and it's easier to qualify for the accommodations because the school's not having to do extensive services, they're just accommodating. So for example, if a student has ADHD, they might need more time to complete their assignments. That's easy to implement in a general education classroom without like needing extra support. So because those things are easier to implement, that's why it's easier to qualify for a 504 plan. Yeah, no problem. And then the Family Educational Rights and Privacy Act, this is also known as FERPA. So this is kind of the school equivalent of HIPAA. So it's just confidentiality, protecting student educational records. This applies to all schools that receive funding under the United States Department of Education, so all public schools. This gives parents rights with respect to their children's educational records. And then these rights transfer when the student reaches 18 years of age, and then the student is the one who's responsible for those records. Parents and eligible students have the right to inspect and review educational records. They have the right to request that the school corrects these records if they're incorrect. And schools must receive consent from parents in order to release educational records unless it's requested from the ones listed here. So schools with legitimate educational interest, other schools where they're transferring. So for example, if a student is going from one school to another, we don't need parent consent to send the records over to the new school because the student is transferring. But in other situations, we would need parent consent to transfer those records. And then now the main point of this presentation, the assessment process. So I'll first talk about types of IEP evaluations. So there's initial IEPs, which is the first time that a student is ever evaluated or suspected to have a disability. And then an annual IEP is what happens every year. So a child who already has an individualized education plan and they already have goals, they will have an annual meeting to go over the progress they've made on those goals and propose new goals if needed, or change the goals if needed. And then a triennial evaluation is every 3 years. So this is also for children who already have an IEP, and they get a full reevaluation. And this is the one where school psychologists are typically only involved in the initial or the triennial because that's when we do a full reassessment. For the annual, it's typically the teacher who talks about the goals and the progress they've made, and also speech pathologists. Any service providers, they'll talk about the goal progress at the annuals. And then lastly, this is a more unique one, but conditions warrant assessment. So sometimes if we have a student who already has an IEP, but they're not due for their triennial, but we find that they're demonstrating certain challenges, like maybe they started showing some speech difficulties or some behavioral difficulties, and we feel that we need to do additional evaluation, even though they already have an IEP, then we might do a full reassessment if we see that need. And this is typically because parents or teachers or both express that need. So the first part of the assessment process is a referral. Parents or teachers may refer a child for evaluation, and this is typically done with a written request. It can be submitted either as a hard copy or in an email, and it can be addressed to the school administrators or the school psychologist, or even if you give it to your child's teacher, they will give it to the right people. Once the school receives a written request, they have 15 days to do a few things. They need to respond to the written request. So either call the parent or the teacher or whoever made the request. They need to schedule a meeting, which includes the parents, teachers, and other relevant people to discuss what the concerns are. Like, why are you requesting an evaluation? And then they can propose an assessment plan if they decide that that's necessary. So an assessment plan is where we outline what areas we'll be evaluating in. So on there will be speech language, there will be adaptive behavior, cognitive, academic. So some students have everything where they need to look at their academics and their behavior and speech as well. Sometimes it's just a speech evaluation, sometimes it's just academic. So it just depends on what that student needs. And then if we decide that a student does not need it, then the school has the right to deny that if there's not enough supporting evidence to show that the child does need one at that time. And then sometimes we'll say something like, we'll reconvene in a month or a few months and see how the student does with certain accommodations, because accommodations can be provided without an IEP. So for example, if we say, let's let this student have a little more time on their assignments, or let's let them take their tests in a different room and see if that helps. And then we say, we'll reconvene in a month and see if it helps. If it hasn't helped, then maybe we'll consider a full evaluation. So requesting doesn't guarantee that you'll get an IEP evaluation. It all depends on the circumstances. And then the evaluation. So the components of a full evaluation are first, we typically will do a records review. So that's just looking through the student's records, including report cards, health and medical information, background information, benchmark testing results to get an idea of the child's strengths and challenges. And then we'll do interviews. So to get a better idea of the challenges the student has, then we'll interview parents, teachers, and if the student is old enough and is able to communicate in that way, then we'll interview the student as well about what is difficult for them and what they're having a hard time with. And also we send home and to the teacher some standardized questionnaires, which we sometimes call them rating skills. So this is where we ask about students' behavior and social emotional functioning and see if those are concerns as well. And then we do observations. So students are typically observed in multiple settings, including the classroom setting and social settings such as lunch or recess, to see how they're functioning in the school setting. And then lastly, direct testing. So we do direct testing with the student in the areas of suspected disability. So at me as a psychologist, I would do the cognitive testing, and then our speech language pathologist would do speech evaluation, and we'll talk more about that later. And then sometimes we may have an occupational therapist who's looking at motor ability, and then an educational specialist will look at academic areas of challenge, and then social emotional behavioral, that we typically get just from observations and also parent and teacher interviews to see if there's anxiety or if there's some behavioral issues that are happening. And schools have 60 days from the date of the assessment plan being signed to complete the assessment and schedule an IEP meeting. So this is kind of just like a legal thing that a lot of people don't know, but after the parents sign an assessment plan, the school has 60 days to complete that evaluation. And if they don't, then they can get in legal trouble for that. And then I kind of mentioned this, but these are the people who are involved in the evaluation. So the school psychologist typically will do cognitive intellectual testing. They look at social emotional, they look at behavioral, and then education specialists will look at academic areas. So they'll do specific testing and direct evaluation to see if this student might have trouble with reading or they might have trouble with math. And then speech language pathologists, which again, we'll go into that more in detail, but they look at language, communication, and speech. Occupational therapists would look at motor difficulties, including fine motor skills and gross motor skills. And then physical therapists, this is pretty rare, but sometimes they do get involved in certain cases where there are physical challenges. And then the school nurse does health and medical, including vision and hearing. So we always say that you have to rule out medical before you look at anything else. Sometimes it's as simple as a student needs glasses or they can't hear. So they might present as a student with ADHD or autism when in reality they can't hear what's happening in the classroom or they can't see the board. So that's why we always try to do that first and make sure that the student passes vision and hearing. So the school nurse would do that. And they also do like a in-depth medical background to see if there's there were any birth complications or any other complications in infancy. And then adaptive physical education. This is for children who cannot participate in traditional physical education because they have physical disorders or something that's holding them back from being able to do the things that they do in regular PE. And then a behavior specialist is also sometimes involved. So if there's specific behavioral challenges, if a student is having a lot of tantrums in class or they are demonstrating aggressive behavior, then a behavior specialist would get involved. And I just put here that it's not all of these people will always be involved. It just depends on what that student needs. So if there are no behavioral concerns, then the behavior specialist wouldn't be there. And then this is just my role as a school psychologist in the assessment process. So as I mentioned, we're typically not involved in annual IEPs because this is just kind of looking at the goals, the progress that's been made, and we don't have to do a full reevaluation where we're doing cognitive testing and everything. But we are involved in the triennial and the initial IEPs, during which a full evaluation is warranted. And then, as I mentioned before, we do a records review, interviews, observations, and then I wanted to put in here just the 7 cognitive processing areas that psychologists do look at. So, I mean, it's a lot of detail, but I'll kind of just make it easy. So the first one is crystallized intelligence, which is learned knowledge. So students who might have difficulty with like vocabulary or they're having a hard time learning new vocabulary, just applying their learned knowledge. We see this a lot with students who are English language learners, but then we have to keep that in mind if we're testing a student who English is their second language. We already know that they may have a crystallized intelligence deficit, and it's not that they're less intelligent, it's that they haven't had as much exposure to the English language. And then fluid reasoning, this is typically associated with like math and problem solving, just being able to see a complex problem and solve it. And then long-term storage and retrieval is being able to learn something and store it and then apply it later. So that's one of the cognitive processing areas. And then short-term working memory is if some of the tests we do for this is, for example, I'll say like 2 or 3 numbers and then I'll have the student repeat it back. And then the numbers that I say get longer and longer to see how much they're able to retain a few seconds after. And then auditory processing is processing information that is heard. So how are they processing what they hear? And like I said, first we would make sure they don't have a hearing impairment. And if they don't, then we see how are they processing auditory information? Is it making sense to them? And then visual processing is similar, but visual. So things that they see, are they processing them correctly in their brain or not? And then lastly, processing speed is being able to do cognitive tasks quickly and efficiently. So this will typically give students a test where they have to find 2 letters that are the same in a line of letters, and they have 3 minutes to do like a bunch of them. And then we see how many they can get through. And then there are norms that we compare it to. If a student is 7 years old, they should be able to do a certain amount. And if they're doing less than that, then there may be a processing speed deficit. And then school psychologists also determine eligibility based on the above. So I'll go into more into eligibility categories later, and then I'll talk more about that. And then lastly, school psychologists ensure that the school is following protocols and legal requirements. So as I mentioned, the 60-day timeline, things like that are typically the school psychologist is making sure that everybody is following those timelines, because if we do have to go to court or there's some legal issue, the school psychologist will take the lead on that with the administrators, the principal and the assistant principal. And then these are some unique circumstances. So prior to testing, students who are identified as English learners are given a language dominance test in both English and their native language. So at the district I'm at, typically this is Spanish, but I've also been involved with Korean testing. So we'll do the same exact test in English and in their native language, and then we see which one they score higher on. And then whichever one they score higher on, that's what we will test them in for the rest of the testing, including all the cognitive testing, the interviews, whatever language they're more comfortable in. And we do this because we want to make sure that their limited English fluency doesn't work against them. And this does unfortunately happen a lot, where students who are not as fluent in English maybe like people think that they might have a learning disorder or they think there might be something wrong, when in reality they just don't have that English fluency, and it's making them appear like they have other issues, but they actually don't. It's just the language. So we have to be really careful about that, and they're really pushing this in grad programs right now too, just multicultural assessment, how to make sure that we're not letting this happen. And then students who have limited language abilities due to speech or language impairments or autism or other developmental difficulties, we give them tests that involve less language. I've actually given what we call like a nonverbal test, which is completely nonverbal. So I don't say anything. I use gestures, I point to things, and I have the student point to things as well. So if they are not able to communicate as well as other students, that shouldn't work against them. Because I've had a lot of students where their verbal IQ is extremely low, where people would think that they might have some kind of intellectual disability. And then when I test them using nonverbal modalities, they do perfectly average or above average. So there are a lot of kids like that where they are extremely intelligent, but they don't show it the same way as other kids do because they don't communicate the same way. Okay. And then, so as I'm, and as I mentioned, the identification or eligibility categories. So based on the results of the evaluations, the student may or may not be determined eligible for special education services. The eligibility categories based on California Education Code include these. So autism is one of them, and deaf blindness, emotional disturbance. This one, I don't like the name of it. A lot of states call it emotional disorder instead of disturbance. But it can be anxiety, it can be a student who's been through significant trauma in their life, and because of that, they're presenting as somebody with a learning disorder or something along those lines, but in reality, it's because of what they've been through emotionally. And then hearing impairment, intellectual disability is what they used to call mental retardation, but we're not calling it that anymore. That is where their IQ is significantly low, and they are showing that they have an intellectual disability. And then multiple disabilities, orthopedic impairment, other health impairment, that one is very vague. It can be ADHD, it could be anxiety, it could be that a student has cerebral palsy or they have some other kind of medical condition that is making it harder for them to access the general education curriculum. And then specific learning disability, this is what those 7 cognitive processing areas that I mentioned. The way that we qualify for specific learning disability is we compare the academic testing to the cognitive testing. And if we find that a student has overall average IQ, but they are still performing low in some academic areas, and they showed some weaknesses in one or two of the cognitive processing areas, and they all connect. So like I said, fluid reasoning connects to math. And there are they all connect to different academic areas. So in order to qualify a student for specific learning disability, we would have to make a connection between cognitive processing weaknesses and academic weaknesses and show that, okay, because the student has a fluid reasoning deficit, they're performing poorly in math. And if we can make that connection, then we're able to qualify them for specific learning disability and they would get academic support. And then speech or language impairment, which Ms. Naila Qureshi will go over in a little bit, and then traumatic brain injury and visual impairment. And when a student is found to be eligible under multiple categories, which does happen, I've even seen students where they have 5 of these categories on their IEP. Typically it's 1 or 2, but sometimes there's up to 5. There could be as many as they need. And we find which one is the primary disability and which is the secondary. So what we see a lot is like autism as a primary and speech language impairment as the secondary. So we just have to decide what is impacting them the most and then go from that. And I wanted to really emphasize that educational eligibility and medical diagnosis are not the same. So at the school district, we cannot and do not medically diagnose students. So for example, a student could qualify under autism at school for an IEP, even if they don't have a medical diagnosis of autism, and vice versa. A student with a medical diagnosis of autism may be doing fine in school and then they wouldn't qualify for special education services. So the way we determine eligibility is based on the impact that it's having on that child's educational experience. So if their grades are fine, they're behaving fine at school, they're getting along socially with other people, then we don't really need to worry about giving them an IEP or giving them these services, because then we would actually be pulling them out of class when they don't need to be getting pulled out of class. So I've worked with a lot of kids who have a medical diagnosis of autism, but they don't have an IEP. And it's because it's not impacting them in that sense. And some of those kids may have a 504 plan, like I mentioned, if they need it, but a lot of times they don't. And it's because it's not impacting them in the school setting. And then it's a lot of times with ADHD specifically, when we qualify a student for other health impairment because of ADHD characteristics, parents get really worried and they're like, oh, are you diagnosing my child with ADHD? And we have to clarify that we're not diagnosing, but we see characteristics that are associated with ADHD and it's affecting them in school. And because of that, we need to provide them with the services that we would provide to a student with ADHD. It doesn't mean that they have it, they may not, but they are demonstrating inattention or hyperactivity. And because of that, we need to give them those services. And then the IEP meeting itself, an IEP meeting is held with the IEP team, which includes the parents, to go over the results of the evaluation and the eligibility decision. And many times after the completion of an IEP evaluation, a student may not qualify. So as I said, just because you request an IEP evaluation, you may or may not get one. And then even if you do get an IEP evaluation for your child, at the conclusion of that evaluation, they may not qualify. And that's just something that it depends on the results of that evaluation. Sometimes after doing all the testing, we find that a student really doesn't need additional services. They don't need an IEP. So that's always a possibility. And then for triennial and initial IEPs, we discuss eligibility, like those categories I mentioned, as well as placement and services. For an initial IEP, once a student is determined to be eligible for special education services through an IEP, the school has 30 days to develop an IEP. So this is another one of those legal timelines that we have to follow. And then for annual IEPs, only present levels and progress on goals are discussed, and new annual goals are proposed if previous goals are met. So we wouldn't do a full cognitive evaluation at an annual IEP. And then this is just the breakdown of the IEP meeting itself from start to finish. Every school does it different, districts do it differently, but the way that I'm most familiar with is what's called a facilitated IEP. So there's a facilitator who is running through all the points of the meeting, but it is very much a discussion where everybody's involved. And we use what's called the patterns of strengths and weaknesses model. So we compare the students' strengths to their weaknesses, and that's how we decide what they need and where they need help. So first we start with the purpose of the meeting, which could be an initial, it could be a triennial, it could be a requested meeting. Like IEPs can be requested by the parents at any time. So even if it's not the student's annual or triennial, if the parent feels like there's something they want to discuss, like maybe they're noticing a new behavior or a new challenge, they can request an IEP meeting at any time. That's one of the parent rights. So we start with the purpose and then we make introductions. So everybody goes around and says their name and who they are and the role that they play in that meeting. Then we review the agenda, the group norms, and the meeting outcomes. So just kind of basic rules and guidelines for the meeting. And then parents are asked if they have any questions or need an explanation, or if they need a copy of their parent rights, that document that we discussed. And then we talk about present levels of performance in terms of strengths and challenges. So each person at the meeting, including the parents, will go over things that they believe to be their child's strengths, which could be anything. It could be academic, but it could also just be general, their personality, something that they've noticed about them. And then challenges, which can also be general or academic or based on the evaluation results. And then if the student already has an IEP, then this is also when they would discuss goals. So when we talk about strengths, they would talk about the goals that have been met. And then when we talk about challenges, they would talk about goals that have not been met or progress hasn't been made on those goals. And then for triennials and initials, we would talk about eligibility. And again, we wouldn't talk about this in an annual. So that's where we talk about the categories and which category the student is eligible under, if any. And then if they're found eligible, then the team would make proposals to address the challenges. So they could be goals, they could be accommodations in the areas that the student is struggling in. And then we talk about special factors, statewide assessments, and then continuum of services, which I'll discuss more in a little bit. So that's basically just like levels, and I'll get into that next. And then potential harms and benefits of the proposed IEP. So for example, if they're proposing the student should go to a special day class, like a special education class, we would talk about potential harms and benefits of that placement. And then offer a FAPE, so that's free and appropriate public education. That's where we talk about services and setting. So services would be which services they're receiving and the frequency and duration of each. For example, they might get counseling once a week, 30 minutes each time. And then setting, like I said, could be special education classroom, it could be general education classroom, and we'll talk about that more. So before I go into the continuum of services, I wanted to mention that special education is not a place, it's a service. So a lot of people think that being a special education student means being in a special education class, and that's not true. Although some students do require more restrictive environments, such as a special education class, this is not the only option, it's just one of them. So this is the continuum of services from least to most restrictive. So general education classroom with no additional services or supports would be the least restrictive. So you're in general education all day, every day with typical peers. And then the next level would be general education classroom placement with push-in support. So we have in our district classes that are co-teach classrooms, and this is still considered general education, but it's taught by a general education teacher and a special education teacher together. And the benefit of this is students who have an IEP but are not having significant enough challenges to be in a special education class, they are in a general education class, but they have that additional person who has special education training in their classroom all day, every day to provide that additional support. And they know about IEPs, they know how to implement an IEP. So that's the benefit of a co-teach classroom. And I've seen a lot of kids get placed into that kind of setting, especially this past school year. And then the next level up would be general education classroom placement with some pull-out support. So this means where a speech pathologist or a counselor or occupational therapist would come to the classroom and say, okay, I need to see this student for 30 minutes, maybe once a week, maybe twice a week. So they are in a general education classroom, but they're being pulled out of class for a portion of their day or their week to get that extra support that they need. But they're still in general education. And then the next level would be a self-contained classroom. So this is what people typically think of when they think special education. And this is where they're removed from their typical peers. So in our district, we call this a special day class. Different districts call it different things. And it's within a public school. And they have some mainstreaming opportunities. Mainstreaming means just being with typical peers. So that would be during recess, during lunch, during PE. Sometimes they even have like a buddies program where general education students come into the special education classrooms and work with the kids so that they're exposed to typical peers. And then the next level would be self-contained classroom within a non-public specialized school. So there are schools that are specifically for students with autism or specifically for students with behavioral difficulties. That would be the next level. And then after that would be home hospital or schooling within the home environment due to being unable to attend school. For some kids, they have extreme anxiety to the point, and this is unfortunately something we've seen a lot after COVID. A lot of kids are scared to come to school because of COVID and because they don't want to get sick or because they are not used to being around kids anymore. So in that case, we would have to provide the services within their home, whether that's on Zoom or somebody coming to work with them once a week. So that would be almost the most restrictive. And then the most restrictive out of all of them would be a residential program. So this is, again, a non-public specialized school, but where the student actually lives there. So they're there all the time. So group homes, there are shelters that do this where they live and go to school at the same place. And it's for kids who have very significant behavioral difficulties, or they have a really bad home life. Maybe they were removed from the home because of child abuse or other bad situations that are happening, and they would be put into a program like this. So that's the most restrictive. So this is all the different options that there are for students that have IEPs. There are students who are just pulled out maybe like once every 2 weeks. So it just depends on the needs of that student. Having an IEP doesn't mean that they will be in a separate classroom. That's only for certain situations. And then these are some of the services or supports that students who do have an IEP could receive. So speech and language services, occupational therapy services, physical therapy, adapted physical education, specialized academic instruction. That's what we provide for students who have a learning disability, just that extra academic support. Counseling, health or nursing services. This is typically for kids who have like diabetes or other health issues where they need to take medication once a day, or they need to have consult with a nurse to discuss their health issues. And then intensive individual services, that's what my district calls it, but that's just one-on-one aid support throughout the day. So some kids have an adult with them at all times throughout their day. Some kids have an adult with them for maybe part of their day or half of their day. And this is for kids who have maybe very extreme behavioral difficulties, or we have kids in our school that try to run, like they elope off of campus, and obviously that's a danger to themselves. So they need an adult with them at all times to protect them. So that's another option for a service. And then transportation services. A lot of times if the special education program is not available at someone's school of residence, then they have the option to be transported to the school that has what they need, even if it's not close to their home. And then adaptive equipment and technology. So this could be a communication device like an iPad that they can use to talk to people if they can't vocally speak. And then a hearing aid, visual aids, those are all adaptive equipment or technology that can be provided to a student. And then lastly, these are just some reminders that I wanted to put in here for parents. You are your child's greatest advocate, so don't hesitate to ask questions, ask for clarification, or express your disagreement or dissatisfaction. You're a valuable member of the IEP team and you do have a voice, so don't be afraid to use it. A lot of times parents think that they need to just listen to what the school says or just sign off on the IEP even if they don't agree with it, and that's not true. There's a reason that all of these parent rights are in place and they're part of the law. So you do have the right to disagree and to state how you feel. And then although there are always exceptions, the majority of educators do genuinely care about your child or your children, and they want them to succeed. So unless you have a good reason not to, try to trust them and try to understand that they also have your child's best interest in mind. And your child's school and the staff at their school are not your enemy. They're part of your team as you're part of theirs. And if we work with them instead of against them, then your child is more likely to be successful and happier at school. And then I know it's extremely difficult to hear that your child is struggling or has any type of disability. And I know especially in our community, there's a big stigma against that. But denying their help that they're being offered would actually put them further behind. I've seen it, unfortunately, a lot more than I would like to, where parents refuse to get the services that we're proposing for their child because they say, oh, there's nothing wrong with my kid. You know, my child's fine. And we're trying to help their child, but they're denying that help. And then what happens is that same child gets worse. So their behavior difficulties, their speech difficulties, they only worsen over time because they're not getting intervention. So the earlier you provide that intervention and you allow us to provide that intervention, they will progress. But if you keep refusing it, then they will just get worse. And then you have a child who's maybe 2 or 3 years behind instead of just 1 year behind. So that's something I really want parents to understand. And as I said, special education is a service, it's not a place. So just because your child may need speech or they may need academic support, it doesn't mean that they're not like other kids. All kids have challenges and strengths, and all of us do. So just accepting that they do have certain challenges and letting the school help them with those challenges would make a huge difference. And then another thing a lot of parents don't know is if your child is evaluated and found to be eligible, but the parents refuse to accept the services and supports offered to them, the school does have the option to request due process against the parent. So if we feel, and I again, unfortunately have had to be part of this, where if we feel that a parent is denying something that a student really needs, and they just are not accepting that they need that help, and we feel like it's a disservice to that child, they really need that help, then we can file for due process against the parent because they're not providing what they need to. And that can also turn into a CPS call or child abuse because it is neglect to not provide a child with what they need. And then lastly, just breaking that stigma, as I mentioned, about children and adults with disabilities or special needs. We all have our own strengths and challenges, and that doesn't make us inferior to anybody else. For some people, their challenge may be that they can't speak. For some people, their challenge might be that they can't sit still for too long. But we all do have those challenges. They just look different for different people. And we need to be open to providing that help to the people who need it so that they can progress. And then that's it for my presentation. And if anybody has any questions, that I can answer them. And if I don't have the answer, I'll find it. But any questions? Yeah.
as I mentioned, I work here at Untitled Academy, so we're a private school.
Yeah.
If teachers find concerns with a student
Hmm.
and they share that, they usually share that with the administration, and the administration will request the parents, because like you said, we can't diagnose.
Yeah.
Um, the parents then will go to their district where they live, and they'll be able to do a similar process like this.
Yes, so that's the requirement of the district, is whatever district is your district of residence, they do have to provide it. And we've had students come to us because they go to a local private school and they come to us for an evaluation, and we do have to do it. So that's the option they would have, is to go to their school of residence or their district of residence, and then they would have to provide this evaluation. Yeah, and then they would get input from the teachers that work here as far as what the challenges are, what the concerns are, and they would take their input, because obviously they don't know the student. So they would have to get input from the parents and the teachers who do work with that student, and then build their evaluation on that.
This year we did have a case where one of the families did want their child to go through this process. So the local district did come out several different times, sent different members of the group to come out. They observed, they watched, and they met with the parents, they met with the homeroom teacher as well. So it was something very positive.
Yeah.
We got back, and that was shared with all the teachers, so they made their own accommodations and adaptation for him.
Oh, good. That's good.
Yeah, we were very happy. So that's what we're letting parents know. In cases of, where it's so severe that we don't have the resources here, we're very upfront with the families. We say, we want the best for you, but we can't offer that resource.
Yeah.
So it would be better if they go to, your public school. But in cases where we can, that's where we do it. So, but thank you for your presentation. This was outstanding.
Yeah, of course. Thank you. I'm glad to hear that you went through that process, because I know, like I said, there is that stigma, and there's that. I know a lot of private Islamic schools don't have that. They don't have school psychologists. We don't have speech language pathologists. And I don't know how that would work, but I hope to see that eventually we can have something like that, or at least more awareness, so that people know where to go. If they can't get it at the school, then where they can go and get it done. So I'm glad that you guys did that.
That's why I was excited to see you coming here.
Yeah.
The only asterisk I would have is it's coming at the beginning of summer.
I know,
So
yeah.
So if you could duplicate this in the fall, in August and September, we would greatly appreciate it.
Yeah, the goal is, inshallah, to grow with even more people, like special education teachers and other people who are involved in this process, and take this same presentation to different masjids and to different private schools, so that they have the information, because a lot of people don't have it. Parents and schools both don't have it. So we definitely want to do that, inshallah. This is just the start, but we want to grow it.
And I can add to that is not only Islamic private schools, but Christian schools or any other denomination, they do not have the ability to provide special ed services. So children that up to kindergarten age, they can receive walk-in services at their public school. So, but the parents have to take them. And beyond that, for speech therapy, it's a consultation model. So if they choose to stay within the private school setting, then they can receive consultation services depending upon how it's decided during the meeting, the special ed meeting that they are going to have in the private setting, and they can consult with either a speech language pathologist or other service providers with the school district. So that's another option.
Yes, that's fine. Okay.
I want to know, as a teacher, what is my right? Do I have the right to ask the parents if they have their children taking IUP? They have. Do I have the right to know as a teacher?
Do you work in a public school or private school? Oh, you're here. Okay. So you can ask. I mean, it's tough because I know a lot of parents will respond negatively to that. That's the problem. And
Because of the stigma, you see,
Yes,
They don't share.
exactly.
If you see that he is having an issue.
Yeah. I mean, maybe not ask if they have an IEP, but maybe like, oh, have you noticed any challenges? Is there anything that you're doing that helps? You know, those kind of things, more open-ended questions. Because if you ask, like, do they have a diagnosis or do they have an IEP, that may cause more of a negative reaction. Whereas if you just ask, you know, I've noticed these certain challenges, have you noticed this at home? And just making it clear that you are working with them, not against them. Because a lot of times it's taken as just criticism, you know, and they're like, oh, how can you say that about my kid? But if you say, we want to help them, have you found anything that helps with this particular behavior that we're noticing? Is there something that you suggest that we can try? Maybe just working with the parents in that way. And then I'm not sure how it works in private schools as far as if kids do have an IEP, if they need to provide that or not. But unfortunately, even in public schools, we've had kids come in and parents don't mention that the kid has an IEP. And then they go years without getting services. And then they complain and they say, oh, my kid is supposed to be getting this. And then we say, you never told us that. So there is that breakdown in communication. And I don't know what the protocol is for private schools. If you can ask, if you can't ask, if they need to provide that when they provide you with the paperwork. But even, like I said, even in public schools, there's no way to make them provide that. We ask, but if they don't tell us, then there's nothing else we can do.
I know, do I have the right? This is crucial. Do I have the right? Because I'm a mandated reporter.
Yeah, that's true.
This, do I have the right or not?
But I think because you're in a private school, you don't have to implement an IEP. Like with public schools, we're held by the law, like I talked about. Like we have to provide those services, right? So because of that, we have more of a right to ask them because we could be taken to court for it if we don't. Whereas with private schools, they're not held to those same laws because it's not the same. You're not receiving that same federal funding from the US Department of Education. So that's where the difference comes in, is with the law. And that's where it gets kind of blurry as far as like what's allowed and what's not. So I don't think you would be able to ask it in that way where like do they have an IEP, or making the parents provide that the way that public schools would be able to. But like I said, I think the best way to do it is to just make it more of a collaborative, like I want to work with you to help your child. But I know that's easier said than done because a lot of parents are not open to it.
The problem is, you try to make special accommodation.
Yeah.
There are other kids in class.
Mhm.
You need to be giving more attention to them, not to this specific or these specific children.
Yeah.
So it's going to affect the whole class. And
Yeah.
If the parents are not so transparent with you and they're not having that denial,
Yeah.
it will be easier. So you know that this is how it's established because of the school environment. It's the child, he has a problem. And then you're going to figure out a special accommodation. But with this denial thing, and you start questioning myself, is it me?
Yeah. I mean, what I typically tell teachers is that if you're providing that extra layer of support to a student, you might as well provide that to your whole class because it's not going to hurt anybody. So for example, some kids respond better to positive reinforcement, like, oh, if you get this many stickers, you'll get this. And some kids need that more than others. I mean, all kids like positive reinforcement, but some really need it. And they need like a visual. They need to be able to see how many stars they got. So if you apply that same thing, rather than spending extra time on one child, if you provide that to everybody, it won't hurt anybody. So it makes it easier on teachers because you're still spending a little bit of time, but at least you're not putting any other kids at a disadvantage because they're all getting that. And it's not like it would hurt them, it would only help. Even if they don't really need that level of support, extra support is never a bad thing. So I would say just whatever strategies are working on that one or two kids who are having a harder time, just apply that to everybody. And it would only cause positive change. I don't think it would hurt anybody. Yeah, go ahead.
And you see, after COVID, most children have been sitting at home using screen time a lot.
Yeah.
And seeing the impact on their attention span.
Mm-hmm.
And I'm not. I'm starting the questioning process. Is it because of this issue, or do they have an issue? So the very reason I'm here. How do I identify this child really has a big because most of the kids are really having attention span issues
Yeah.
and focus issues. and they need movement. We know how to address that.
Mhm.
The attention thing. How do I identify he does really have a big problem?
So typically, we don't even look at ADHD as a potential issue until after age 7. And the reason for that is because, like, even my son is 5, and at that age, they're just hyper. That's just how it is, right? So they can't sit still for too long. They need to move around. And then, as you said, COVID definitely made that worse. Screen time makes it worse. All of that contributes. But it's also just their developmental age. Before age 7, they are more active, and they have shorter attention span. After they hit age 7 and we still see it, and we see that it's impacting their school, they're not able to get their work done, that's where we actually evaluate for ADHD. But what I always advise people is don't even consider it until they're 7, unless it's extreme, like to the point where they're not sitting at all, they're not getting any work done, like they're not learning, then maybe you can consider it. But if it's not that intense or extreme, I would say wait until they're a little older and then reevaluate and see how it's impacting them in the school setting. Yeah. Yeah, no problem.
So, if our parents decide to put their child in a private school
Mhm.
and the child is transferring from a public school and they have IEP and they have some extra services that the public school is providing, what if the private school does not have those services? Can the parents go back and forth between private school and get those services that the child is getting from public school?
Yeah, that's basically what happens. We've had students that come to our school for speech or for certain services that are not available at the private school that they go to, because it still needs to be provided. And I think you had mentioned that too.
So I do want to emphasize that is up till kindergarten. You can take your child to your local public school for walk-in services. After that, it's going to be a consult. So if you choose to stay in a private school setting, the speech pathologist might consult like once every 3 months, once a month, but it will not be a direct service. So at that point, the IEP after kindergarten turns into an IFSP. So as the teacher over here was mentioning, if they come with an IEP, so beyond first grade and beyond, they will not be on an IEP if they stay in a private school setting, sorry.
Yeah, so the consult would look more like they're just talking to the school and, kind of talking to them about what the student needs, but they're not working directly with the child. That would only be within a public school where they can get their 30 minutes once a week or whatever their IEP says. Yeah. Yes.
Could you recommend either a website or a book or other resource like a kind of a parent's guide to special ed?
I don't have one off the top of my head, but I can look into that and see. It's just like there's so many aspects to it. So it depends on what they're specifically looking for. Like if it's behavior, then there'll be a book about that. If it's speech difficulties, there'll be a book about that. If it's special education law, then there's a book about that. Yeah, there's just so many different aspects to it. Mm-hmm. Any more questions? Yes, go ahead.
So you had a slide about the different restrictive, classroom.
Yes.
Kind of.
Mm-hmm.
And I noticed that at some point it went from very not restrictive at all to pretty limited interaction with children
Mm-hmm.
and stuff like that, to the point where it's self-contained classroom
Yeah.
with no interacting with the mainstream,
Mm-hmm.
no mainstreaming. So in that case, when you're going to a non-public school, you're going to be required to be paid for that private school, right?
No. So if a student needs that level of support and let's say they attend a public school district, that's on the school district. So they would pay for that.
Okay.
So if we find, based on our evaluation and data that we've taken on a student, I've seen a lot of kids because of behavior go to non-public schools because they're extremely aggressive and we just can't contain that behavior in a public school. And then we would have them go to a non-public school, and then the district pays for that because we're the ones who are saying they need to go there. So that wouldn't be fair to put that on the parents.
Even when you were what was the most restrictive? Was it
Residential program.
would that also
if the school is the one who determines that as necessary, then yes. And if we have noticed it and because typically that's the school, it's in the school's advantage because we can't, like, it's harmful to the other students, it's harmful to that student, it's potential for lawsuits. So it actually is cheaper and easier and just more beneficial to everybody involved to move that child to a non-public school for everybody's safety. Yeah, so that would be on the school district to provide that service.
And can those restrictions or can they be changed?
Yes, it changes all the time. So we have kids that start out with being in a very restrictive environment, or like I said, kids who get sent to a non-public school and then they come back. So when we see that they've made progress in their behavior, I've seen kids come back from a non-public school back into a special education classroom. And then I've seen kids go from a special education classroom to general education. And I've seen kids not even have an IEP anymore because they don't need the services anymore. Yeah, so it does change all the time, and that's what we're constantly monitoring for, because the goal is to be in the least restrictive environment, and the law dictates that we need to keep kids in the least restrictive environment. So that's always the goal, is to move them to a less restrictive environment over time. Mm-hmm. Yes.
When you were talking about the percentage of the child, like if their mom is in classroom, who sets up the percentage of how much time they can spend in the mainstream courses?
The service minutes dictate that. So if a kid has 30 minutes of speech, obviously that is removed from general education. So that's considered, and I know if other people aren't familiar, in the IEP, we talk about percent of time in general education and percent of time removed from general education. So out of the 100%, a student may be in general education only 20% of their day. And it just depends on the services. So if a student is getting speech and specialized academic instruction, those would be non-general education. That would be part of that percentage. And then so it just depends on what they need and what they're showing the need for, the level of support, the level of service that they need, how much mainstreaming they're able to tolerate, and like without making it difficult on the child themselves and also on the teacher of that general education classroom. Yes, go ahead.
Sorry, what is the difference between general education and special education?
So in terms of the classroom, so a general education classroom will typically have more kids and only one adult, maybe two adults. And a special education classroom, like the self-contained classroom that I mentioned, has usually about half the kids, if not less. So instead of 30 kids, they might have like 15. Some of them even have 10 or less than 10, depending on the behaviors of the children in that class and how much support they need. And they'll typically have more adults because they have one teacher, but they also have aides. Some of the kids might have one-on-one aides that stay with them all day. So you have a lower ratio as far as like adults to students. And they try to keep it as close to like 2 to 1 as possible, depending on the intensity and the behaviors and everything. But if you look at a special education classroom, there's a lot more behavioral support. There's a lot more visuals where they have like maybe a visual schedule. They have timers. They have things to support behavior and transitions and routine. And then more adult support and less students, just so it's easier to manage. Mm-hmm. Okay, if there are no more questions, I want her to be able to do her presentation, and then we can do more questions after too. But she's going to talk specifically about speech evaluations. Okay.
So, all right, so I'm a speech language pathologist, and I will be using some of the, is this mic close enough? All right, and if we have, it went to the, which is fine. We already talked about the IEP process and how we qualify. So under the big umbrella of special education, speech language pathology is one category. And I will be using some of the slides from Ayesha, which is our credentialing association for speech language pathologists, audiologists, and it's research based and all that. So they have up-to-date information. So even when you're asking about where to get information, so American Speech Language Hearing Association, Ayesha, that's a great website for parents to find resources. So and then the second slide is when you come with questions like, what is a speech language pathologist? Yes.
Sorry, just before you continue, will the slides be available for anyone who wants access to them?
I can send it, or we can figure out a way to make that accessible. Yeah.
Okay. Yes, the parent guides or questions, that part I can share, because this was a short notice, very quick, so I need to refine. So we can provide the strategies for parents and for the classroom teachers. We can make those available, so they are good guides and resources. We can talk about that. So the questions I will be answering here are, what is a speech language pathologist? What is speech and language? What are the developmental milestones? And as a parent, if you think I have concerns, what should I do? How can the school help? And then how can I support at home? So, and then just like speech language pathologists. So again, they have a master's and sometimes a doctoral degree. And after that, they have to take state exams, have a CFY, which is a clinical fellowship year, actual practice in schools, hospitals, nursing homes, private practice. And then after that, there's a rigorous process to earn the Ayesha certification, which is an American Speech Language Hearing Association. And many SLPs also have to have a state license, which is a California requirement to work in hospitals, clinical settings, and to work in schools have also a credential. So just a little bit about that. And then, so when we talk about speech therapy, it comes under many names. So it's called a communicative disorder, communication disorder, speech language disorder, or speech language impairment. So it all various terms that identify the same disorder. So it is an impairment in the ability to receive, like when somebody says something, how you receive it, send information, how you share what you want to share, process that in your brain, and then comprehend concepts that are verbal. Nonverbal could be gestures or through pictures, graphic symbol system, or through letters, words. And it can affect one's ability to speak, read, write, process information, interact socially, social communication skills, and so forth. So, sorry, and it is an impairment in the ability to understand or express thoughts and ideas. So, and when we say, what is speech and language? So there are categories under speech and language. We'll first take the speech part, which is how we say sounds and words. So that comes under 3 categories: articulation, voice, and fluency. So articulation is how we make speech sounds using the mouth, lips, tongue. So we call that our articulators. And I said, like, how we coordinate our mouth, lips, and tongue to produce the target sounds correctly, each separate sound in the flow of speech. When we are doing it, it just comes so naturally. We move them with the rhythm and coordination that we don't even think about it until there's a concern. And voice is how you use our vocal folds and breath to make sounds. Like our speech is, when we exhale, that's how the speech sound is produced. It's on an exhale. And fluency is the rhythm of our speech, like smooth flow of speech without any interruption, which in speech language world, fluency is stuttering generally. So, and then, yes, thank you. Speech language pathologists diagnose and treat. So taking that first part, articulation. So sounds like, it's a disorder when speech is unclear and difficult to understand, and children or adults, they cannot produce sounds. So they come under 4 categories: substitutions, omissions, distortions, and additions. So substitutions can be like if you want to say think, so instead of the sound, it comes like a f, think. So f for third substitution, or it could be R sound substitutions like wed for red, or it could be dut for duck. So substitution t for the, and T, younger children, those are produced in the front of the mouth. The k, g are in the back of the mouth. So they develop language and skills to produce the sounds timely. But after a certain time, you expect these children to produce those sounds correctly. The omissions would be like ka, and doesn't say the word cat completely, or is saying pay the piano instead of play the piano, or could be like a geen nake for green snake. So omitting sounds, initial position of the word, end position of the word, or the medial position of word. Distortions could be a lisp for sh sounds, that it sounds wet, slushy, or the air comes on the side of the mouth. And then nasal sounds like and So where they could be a word like pencil, but instead of like it sounds like an sound. Or it could be R distortions. They can say R, but instead of teacher, it would be teacher, or it's a spinner, spinor, brador. So that brings negative attention to how a child speaks. Additions are just adding additional sound, like it says like black instead of black, or like dogga instead of dog. So they add an extra sound at the end of the word. So that's articulation. And then we go into, so I just also wanted to share, this is a speech sound development chart. So each number on that chart corresponds with the age of a child. So the sounds you see in those charts, the child is expected to be able to say those sounds by that age. So by age 3, you expect that a child can say like a t, f sound, a k, g, the back of the throat sounds. And by age 6, they have their like R sounds or the sounds, they have acquired them. Now, this doesn't happen exactly at that age. It's a time range. A 2-3-year-old can say the R sound, and similarly, like Sersha sound. So over the span of that age range, by that 6 years, we expect the children to have acquired the sounds. But it is also language-based, like in Arabic, if there's no p sound, like, or p sound. So a child will not have it, and that will be a dialect variation. So not that he's not able to produce it, but once they come to school, so then they can acquire that sound, and it might take time. And so that's the speech language development chart. And then we talked about the voice. So that's another thing that speech language pathologists look at. So a voice that could be in voice and resonance disorder, which can be the pitch that is too high or low, like a voice that is too shrill. That would be a high-pitched voice, or a breathy voice. And a child can have loss of voice. Maybe, like sometimes when maybe going to a game, people shout a lot and they cheer a lot. Then the next day they don't have a voice. So but if they consistently are in that state, that's loss of voice. So abnormal resonance, hypernasality or hyponasality, which like hyper is instead of just and a lot of words sound nasal, like they have a cold or something. And then hyponasal is that they're not able to produce those or ing sounds, ing sounds. So that's hyponasality. And then we talked about fluency. So in classroom, you talk about the reading fluency, but in speech language pathology umbrella, that is stuttering or cluttering. So fluency disorders, which may include stuttering, cluttering. So stuttering, like I said, they are struggling to talk due to sound, repetition, word or phrase repetitions, or they're blocks. They try to say something and they get stuck and nothing comes out, and they just they have difficulty it hinders a smooth flow of speech. And then cluttering, it's not too common, but it is a rapid rate of speech, which is unclear and it's disorganized. Excessive breaks, it can have excessive breaks, and they could clump words together instead of spacing them out. And people that have that are usually unaware of their unusual speech pattern until somebody else tells them that you are doing this, like you need to slow down or your words are clumped together. So, but you don't see this too often. Now, I do want to, so as the picture shows, the child has a lot to say, but they feel that they cannot get it out, or they have embarrassment of how they sound, and then they just sometimes don't talk. But at this point, I also want to talk about developmental stuttering. When the children start to acquire language between ages 18 to 2 years up till 5 years, that is developmental stuttering, that they suddenly start to stutter, which is mild. And a lot of times it gets resolved by itself, which is within 6 months to 8 months. But if it goes beyond that, then that is a concern. And, you can talk to the teacher or the speech language pathologist to bring it to their attention. Factors to consider for that kind of stuttering is that if it comes after the onset is after the age of 3 years, or there's a family history of parents or somebody stuttering in the family, then it is more concerning, even if they are under 5. And male children, boys, are more likely to continue to have those problems compared to girls. So those are some of the things to consider. And then the next one, so we talked about the sound and speech, and now we come to language is also a big part of speech and language assessment and services. So the words we use and how we use them to share ideas and get what we want. So there's phonology, semantics, morphology, syntax, and pragmatics. So phonology is the rules that govern the sounds in our speech. We can say including the rules for combining and using phonemes, which are sounds, and how speech sounds are organized in a language. So how we take sounds and form words. So semantics is what those words mean. So word meaning, word relationships. So understanding meaning of words, phrases, sentences, and using words appropriately when we speak. So morphology is word parts and making new words. So we could say like word like cats. So cat, which means it's a four-legged furry animal. If you put an S at the end, means it's more than one. So looking at those rules. And then also when we go to elementary school, upper elementary, it can, we talk about in that prefix and suffix, like something like word like replace, rewrite, redo, and then ed at the end of the word, which talks about the past. So walked, talked. Sometimes children just talk in present tense, whether in their primary language or English. And at certain point, they need to be able to talk in past, present, and future, and they cannot differentiate that. Syntax is how words are put together. So like we take words and how we formulate into grammatically correct sentences to convey our message. Pragmatics is use of language for different communication situations. And that requires understanding social norms and knowing what to say, how to say it, and when to say it. So that's pragmatics. So spoken language disorders. Again, we talked about the phonology, morphology, vocabulary, listening. So at a younger phonology is association. So looking at a letter, and it is called difficulty with a letter and sound recognition, that letter makes that sound and being able to make that connection. Morphology and syntax, formulating sentences like we talked about, using correct grammar, word endings, like also could be singular and plurals, past and present. Vocabulary, word finding, like appropriate vocabulary, age appropriate, and listening and comprehension. That is what message you received and how you understand it. And then the children can have difficulty understanding or responding. They might have difficulty not combining words, and they might just say a few words, not expand their utterance to a complete sentence as they grow. So the next, we talk about social communication disorders, which may include pragmatics, social cognition, and interaction and language processing. So they are not interacting socially. Use of language is different. So pragmatics is use of language for different communication situations that a child could have difficulty with. For example, social interaction would be able to start a conversation and then maintain a conversation for 2 to 3 different turns, not just say, hi, how are you, but understand the person in front of me is my peer, what interests they have, how can I continue a conversation versus talking to a teacher, what kind of questions they might have, or what could I ask a teacher, and continue a conversation like that. A conversation setting that could be a classroom, if we are discussing a lesson and students are collaborating, versus being at recess and lunch and being able to request to join, to play, or suggest something to play with to your friends and peers. So they can also, so older children can also have difficulty understanding the use of appropriate slang, understanding non-literal language like idioms. Like if somebody says, oh, I was feeling on top of the world, if that comes up in a lesson, and they literally think somebody is standing on top of the world, and then you lose the meaning of what's being talked about. And so there's a lot of academic and social impact with the pragmatic language skills and understanding of those skills. So next we talk about cognitive communication disorders, which may include learning, memory, perception, and problem solving. So being able to retain information, short-term memory, long-term memory, which could be simply from following 1 to 2 step directions, to being able to retain a paragraph length information, to be able to answer a WH, who, what, where, when questions that might be about the story or tell a story sequentially. So holding that information in your memory. Perceptions can affect on communication process. Its effect on communication process is about how the same message can be interpreted differently by different people, like how you perceive a message. And problem solving, can affect the quality of a child's relationship with others, a difficulty coming up with possible solutions, for example, compromise, how to compromise if you're playing. So just even problem solving skills that we developed in play, in work, even as adults. So, and then the next one talks about, so when we talked about self-contained classrooms, children that are nonverbal or on IEPs, this is to have a voice and communication. They also need to communicate, have their wants and needs known. And this is done through augmentative and alternative communication system, which can be high-tech through like iPad. There are apps on those that students can use, and communication boards, to low-tech, which is PECS, Picture Exchange Communication System, which are just pictures that are used to communicate and request and let their needs known. And it can be temporarily used for children when they're still developing in the language, in collaboration with teaching them how to verbally communicate, or a child who's nonverbal, it can be their permanent means of communication. So it's a tool to facilitate natural speech and reduce challenging behaviors due to communication breakdowns. And that's what happens. You get sometimes behaviors because a child can get frustrated because they cannot express their needs and they're not understood by others, whether it could be their teacher or friends. And there's a breakdown in communication that leads to behaviors in the classroom or on the playground. So that is one of the things that you see. So again, language and speech concerns can be broken down into these areas: receptive language disorders, expressive language disorders, speech disorders, and language disorders. So receptive language is trouble understanding what others say. Again, a message a parent can give, a friend can say something, word, phrase, listening to a lesson in the classroom, all the way from kindergarten, preschool to high school. It is difficult for them to retain that information and process it. Expressive language disorder, problem sharing thoughts and ideas. And from the youngest age, I share with parents, like, kids are like sponges. What you say and what you expose to them, they have a dictionary in their head. So with that dictionary, when it's time to share, they use their words, they formulate their sentences, and for developmental age norms, we expect them to use appropriate language, and sometimes they might have difficulty doing that. Speech disorders, again, we talked about articulation, how we produce sounds, stuttering, or could have a voice problem. And language disorders may include reading, writing skills, as these are also a modality for use of language. So if the oral expression is not there, that translates into how a child cannot formulate a proper sentence to write. And if the expressive vocabulary is not there, then they're not using age-appropriate words to express their thoughts. And if they cannot sequence a story, they cannot write a story down. They might have difficulty writing a paragraph. So, and then we go down to guidelines for parents. So if parents, I say, are best know their children. They can, whether they're talking or just gesturing, they can gauge what their child's needs are. And they have this ability to figure out, like, my child, there's something, I have concerns about my child. And if they're parent concerns, they're absolutely genuine concerns. So what parents can do is they can write down their observations or concerns. So, and then talk to their teacher about those concerns, whether they're just being seen at home or in the school setting. And then if their teachers, so that you can collaborate with the teacher to talk about accommodations, whether it could be related to homework or classwork, and then schedule a meeting. Now, in different schools, there could be an SST meeting, which is student study team meeting. Some schools are moving away from that, and it's an MTSS, which is a multi-tiered system of supports. That's what their new area is. Sorry, I couldn't enter it over there. But you can request a meeting with the teacher and whatever your school system, the way it is set up. And then as Ayesha talked about accommodations in the classroom, you can implement interventions at home and school. And then after using those accommodations or interventions, maybe for 6 weeks or language-based, I usually say a trimester at least, then have a follow-up meeting to discuss progress on those strategies. So that's where, in a gen ed setting, least restrictive environment in the classroom, what can be done and to see how to support the child. So, and then we had talked about the California Ed Code, and this piece talks about the speech language pathology part, again, that what areas a student can qualify under in the educational setting, which is articulation disorder, abnormal voice, fluency disorder, which talked about stuttering, and language disorder. And there are certain criterias that for language, when the assessment, and how Ayesha had explained the whole process in detail, getting the permission, doing an evaluation. It could be formal. Informal is collaborating with the teacher, talking, interviewing with parents, observing child in different settings, that it is 1.5 standard deviation below the mean or 7th percentile for their age or developmental level on 2 or more standardized tests in the areas of morphology, syntax, semantics, or pragmatics by scoring 1.5 standard deviations below the mean, which is the 7th percentile, on 1 standardized test, and inappropriate expressive or receptive language as measured by a language sample. So it's not just the test. When I assess, I look at a whole child, and sometimes I say testing is it is a snapshot in time, just captures what the child might be going through that day and how they react or how they answer during that assessment. But then observing and talking to parents and teachers, you get the whole picture, and that decides if the child needs services or they're in additional speech and language services, or their needs can be met in the gen ed classroom only. So in these areas, in the educational setting, it is how speech and language impacts educational performance and social interaction in school settings. So again, like I talked about, family history is considered, or if articulation, if it's a later developing sound, but if a child cannot even say their own name, then I would consider that, that is impacting the child emotionally, socially, because they can't even say their own name. So we talked about the whole IEP process. So it's next slide, sorry. So after doing the whole assessments, if the child meets the eligibility criteria, before I go into this, I did want to talk to you about that. I've seen this over and over again. Due to lack of information, parents think that once a child is enrolled in the school, that's when services start. But the schools, public schools, can assess a child starting at 3 years of age. So they can go to their public school or the school district, and they can say, okay, I have concerns about how my child is not producing sounds correctly, or my child is not forming sentences. And the resources parents can use is even First 5 California is a website by the California government put out for parents to see, okay, by first birthday, what should a child be doing? How should they begin by 2nd, 3rd, 4th, or 5th birthdays, their speech, language, development, so they can gauge if my child is kind of in this area. I mean, there are some late bloomers too, but generally it gives you a guideline. And if you are really concerned, like I said, parents know their children best, then do reach out to the school district and talk that you would like to have your child assessed. And again, the other piece is bilingual. So if the child is behind, sometimes parents say, oh, I speak Spanish, or I speak Urdu or Arabic or other language at home, and that's why the child is delayed. So, and they stop using their primary language. So we always tell them that does not cause a speech and language delay. Please use the language, your cultural language or the language of parents at home, and talk to your children in that. Once they come to school, they will learn English, and that does not cause a communication disorder. So then coming to the service model, they can be, once they qualify after the whole IEP process and procedure that Ayesha explained, it can be consultation, which I said like would be something in a private school setting if the child is enrolled in, or even in public school if it's a very mild need. Once they are over the years, they have had full services and they're almost ready to, my term is graduate out of speech. And then we have a consult, like maybe 15 minutes with the teacher or student once a month, just to see that they are on track. Collaboration, it can be collaboration with the teacher and the student, with the teacher to go into the classroom and work with them and provide support. Direct services can be pushing into the classroom or pulling out of the classroom in the speech setting. And it could be individual one-on-one or a group of 3 or 4 students, which are pulled from the classroom, or a combination of both. In the interest of time, how much time do we have?
We have 20 minutes.
Okay, 20 minutes.
And then maybe like 10 minutes at the end for questions.
Okay.
So,
We might need to answer some questions.
okay, so 10 more minutes of this. And
Okay.
10 minutes of
All right.
questions.
So I will, because I will make the parent strategies and other things available. So I won't go deeply into that once we get to that part, so that I can talk about accommodations and just give a brief overview. So when we talk about the least restrictive environment, so in gen ed classroom, the teachers or the speech language pathologists, along with, they can make support teachers by sharing with them to make instructions visible and clear, like breaking the steps down for that child who's having difficulty understanding directions or following along, and then go back to the child to check for understanding, have the child repeat instructions, even team them up with another peer who can support them, and give them reminders or help them with repeating instructions or following directions. And then when introducing new words, try to use graphic organizers, visual mapping, to come up with word relationships, words like antonyms, synonyms, and provides students who may need visual input to assist with transitions, expectations for the day, so now if they have special ed services, their schedule is more busy than other student in a gen ed classroom, who might just be going to the library or PE. They might be pulled out for resource services, and then, or speech therapy, or adaptive PE or OT, so that they have a visual schedule, and then they can be made more responsible to remember if they're going twice a week, once a week. So speech therapy time, yes, thank you. So this visual, actually a colleague, she shared, because sometimes kids that have received speech therapy services, there are games used to encourage language or to reward what the work they have achieved. So then the kids go home and they say, oh, we played games in speech. So the parents think that, oh, they just play games over there. But it is through games, they are made to work on things that are difficult for them, so that, they can generate more language. And so they are working on their goals, but it appears sometimes that they're playing games. So, okay, so once they qualify for speech services, their goals developed for their individualized education plan, so IEP, and then the SLP, speech language pathologists, work on those goals, and they could look like from a pre-K to elementary level. If they are working on a child that is an autism spectrum disorder, they could be just working on eye contact or turn taking, or having their body face the person they're talking to. So that's social pragmatic skills. And through games and cards, like they're requesting from a peer, learning to lose a game and be gracious about it. So, and then if they're working on artic, so learning to differentiate between sounds, and they can work on rhyming through, to differentiate the sounds, and tapping out syllables. When they leave out sounds, initial, medial, and final position of words. So tapping them out, or saying this all parts of the word, breaking the syllables down, providing a visual when you say them. So things like that. And then Manipulatives are actual items to teach prepositions. Okay, so something is taking a little figure and putting it's on the chair, it's behind the chair, between, how you say between, so that they're able to follow directions in the classroom. And talking about attributes. If you ask a child, what is an apple? They'll say, oh, you eat an apple. Or somebody could just say fruit, but helping them expand their expression. So is like, okay, what does the skin look like? Does it have seeds? What does it taste like? It has flesh. What colors do the apples come in? Where can you buy apples? What do apples grow on? What things can we make with apples, like apple pie, apple juice? So there's a lot of things. So attributes that where they come from, what things that you use them. It could be talking about sequencing stories, retelling stories, making predictions, what would happen next. If the child is on autism spectrum disorder, then using sensory bins and, even shaving creams, Play-Doh while working in speech therapy. So incorporating those items to help students learn their speech and language, grammar, as I talked about that. So in the next upper elementary, it could be, again, coming out of pandemic, peer relationships, social interactions, kids even just generally with social media and being on their cell phones. Kids that don't have impairment have a difficult time holding a conversation, knowing how to converse. And then their attention spans are not there, expressing emotions. It has been a difficult year. If you are experiencing this year was difficult, it has been difficult for, I think, in all settings, because I work in elementary and high school, for students, for teachers. So it has been a difficult year. So we're hoping next year will be better. So, and then teaching students self-advocacy skills. That starts from kinder all the way to high schools. They don't, they're hesitant about asking questions in classrooms. And then, again, we had talked about stuttering. That's another thing, teaching them techniques to build smooth speech. And I might not be able to reach the parent suggestion, so I'll say over here, sometimes just giving them time and space, and their siblings that want to finish sentences for them, and that rushes them, so that anxiety builds up, and that adds to more this fluent speech. So Stuttering Foundation is another. If you Google Stuttering Foundation, they have a lot of tips and strategies for teachers in the classroom, for parents, so that and then they you can learn what techniques to use. Just being patient, giving them their time, even explaining to class, okay, we are all individuals, and that's how he talks. And children are very accommodating; they can understand, and just letting them finish their thought, so that helps. And beyond that, of course, you need the help of a speech pathologist to work on strategies and techniques to help improve their fluent speech. And then, okay, upper elementary, influencing main ideas. That's a big thing, understanding those, expanding expressions, complex sentences, combining words. So it's, okay, so those things. Good, thank you. And then secondary level, again, that is more YouTube, there are YouTube tutorials, there's role play, whether they are ordering at a restaurant or doing a job interview, practicing those, and then writing journals, that helps. And then I will share these with the IIOC so they can share with the parents. And then how to support, so how parents can support. Again, talk to your children in summer. Excuse me. If you can have the ability, take them out to the parks, zoos, have them have experiences, play with them, read books to them, ask questions when they read, okay, who was the characters, what happened. You can, if they say 2 words, eat apple, oh, you can repeat that in model. Oh, you want to say, oh, I would like to have an apple. And then sometimes don't make them say that, because that gets into, breaks up that communication. Just model for them how to grammatically correct sentences, model those sentences for them, and talk to your children. Talk about how things are same and different. If you take them grocery shopping, talk about fruits and vegetables, colors, all those things, how many things, label things, provide vocabulary, correct vocabulary for items, so that they hear it and they learn it. And it can be in your own language, whether it could be Farsi, Arabic, Pashto, Urdu, Punjabi, Arabic, or it could be English. So, and they learn that. So again, talking about prefixes, suffixes. So, and there are a lot of resources that I can share, even on Ayesha, like birth to 1 year, 1 to 2 years. Find, so what kind of speech, language, and hearing development should be there for the children. And this is a research-based, very updated website. So all over US, speech language pathologists, audiologists, hearing specialists, professionals in academic settings, a lot of them contribute to this. So, how to support your child, we talked about that. Yeah, basically that was it. Any questions? I know, a lot of information. Yes.
So we have some questions online.
Okay.
They could be for the both of you, so I just saw them. So the first one is, what about homeschooling students? If the student is evaluated by a charter school and will get some help for IEP, but not enough, can the student still get extra help from public schools?
You want to address this? Okay, first. And then.
I mean, it depends on the charter school or the homeschool that they're working with. Every school approaches it differently. And like he shared, like Minaret is open to it. Some schools may not. They might not even know where to go. So it honestly depends on the school and also the district of residence where the person lives. But you can always start with the district of residence. Even if you're homeschooling or you're going to a charter school, the main advice I would give is to go to your school district where you live and tell them the situation and see what they can offer you. But that's a good place to start, is with the district.
Great suggestion. And then I will add to that is, if you have, let's say if it's speech therapy, you're looking for, and you have insurance, medical insurance, you can go to the pediatrician and they can also recommend those services. Or if the child has medical services, that is another route that they can go through. But of course, do reach out to the school district, see, because each school district has a different set of services that they can offer. So it is always a good idea to ask.
Thank you. There's another question. It's a bit longer, so if you need me to repeat it, let me know. Saddam, say your child has autism and you want them at a certain Islamic school by kindergarten. They have an IEP established for preschool. How possible is it and how long can it take to establish appropriate care for your children's need at that private school, especially if the school is already interested?
Again, it depends on the school, and it also depends on the level of that child's IEP, like the amount of services that they're receiving, if the private school will be able to consult with the school district and make that level of service happen. It just depends. And then, as she mentioned, once they're in kindergarten, it's more of a consult-based thing. So it's really tough. I mean, I wish there was a way we could make it so that private schools are more accessible for students with disabilities, but it's hard to do that because they don't have the resources and the same laws that bind them the way that public schools do. So, I mean, it depends on that particular situation. It's hard to say without seeing the IEP or knowing what that particular child needs, and then without knowing what school they're looking into.
Who would you recommend they ask about these things?
The IEP, the district that's providing them with the current preschool IEP would be where they should ask and just tell them, we're interested in this school and this is where we want this child to go by kindergarten. What can we expect as far as the IEP following that child to that school? And then they can even consult with the other school and see what they can provide. But I would say start with the district that's providing that current IEP and ask them what it would look like.
Yes, so up till kindergarten. So if they're in kindergarten, they can continue on that IEP, and beyond that, it'll be consult. But of course, once they plan to transfer, it doesn't have to be at the annual IEP. They can request an IEP anytime during the year. That's a parent right, and discuss and talk about that, and then they can make their decision.
I have a question. What does the research show about causes behind a variety of speech and language disorders? Is it hereditary? Is it environment? Is it a combination? Is it something other?
You said it. It could be a family history, and then it could be sometimes causes are unknown. Sometimes there are patterns that you see. I mean, right now, like I was saying, this was a very difficult year, not just for children, parents, educators. This year, I saw a lot of students and other speech pathologists in the district that came with stuttering disorders because of anxiety, or maybe last year online being virtual, the referrals were not made, but elevated stuttering disorder. So sometimes it could be hereditary, but others, they're not known. Sometimes it is due to the structure of a mouth, like nasal tones. The flap at the back doesn't close, velopharyngeal closure is not there. So we work with the pediatricians too. They send requests to speech pathologists in school, and vice versa. If we see something ENT related, the speech pathologists do recommend to parents to check with their pediatricians. But yes, sometimes they're not known causes.
And what advice would you give to students if they had something like this? Because they're going to feel very self-conscious. They're not going to want to participate. They want to sit in the back, kind of just go with the flow and go through. What would you tell them, how to kind of break out of that shell?
So let's say if there's an articulation disorder. So in a kindergarten, preschool classroom, there are multiple kids that have that, and teachers, and I'll talk about the school setting. The teachers make them very comfortable. Over the years, they have experienced children having those disorders. They can pick up, like moms, they can quite frequently pick up on what and they, as I was saying, they model, they repeat what the child is trying to say for the other students. And then again, we providing accommodations if they have difficulty following directions, have them get support from a peer, like if you don't have one aid. And so, there are strategies you provide in the classroom. And if they help improve that child, that's well and good. And it's a mild situation. But if it doesn't, you continue to see those concerns and the impact, because IEPs, educational impact, social and emotional impact, that's a big piece. So whatever the concern is, if those are impacted, we move from least restrictive environment, which is just a regular gen ed classroom, from strategies, accommodations, to a 504 plan, to an IEP, to, all the services that a child might need.
I just wanted to add that in this, the key is the adults, because a child, especially a young child, is not going to self-advocate. That's like a big skill that we teach is self-advocating. Even a lot of adults have a hard time self-advocating. So students typically won't tell anybody. They'll just shut down and then it'll get worse. So I think teachers and other adults that work with these children have to really notice these things and then also be careful not to make it worse. For example, singling out that child and saying, I don't understand you, speak clearer in front of a whole class. That can be extremely traumatizing and will make it worse. So just knowing how to address it, being gentle about it, going up to the child maybe after school and saying, would it help if you sit closer to the front? Would it help if you can write it down instead of say it so that I know what you need, you know? Just accommodating. That's the big part of it, is the adult's role in it.
Sorry, you had a question?
So, what would you suggest to a child who just has a speech therapy or language disorder? If the parents wants to start, like let's say for my daughter, she's already 5. I want her to start learning Quran. What would you suggest? Like, would it be way more? Would I put a more burden on her because she's already behind?
No, each child is an individual. We say they learn at their own pace. So if they're a little bit behind than their typical 5-year-old, that doesn't mean that learning should stop or they are not capable of learning. Maybe she'll take a little bit longer, but it's fine as long as, as a parent, you have the patience and the teacher has the patience to teach them and just let them learn at their own pace.
Also, IIOC has a special needs Quran class that started recently. So I would say look into that because you want teachers who understand and who are able to accommodate that because it is difficult. So teachers who do have that training and that exposure would be better. But like she said, it wouldn't work against them. It's always worth trying. And then the teacher will work at their pace.
Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar. Ashhadu an la ilaha illallah. Ashhadu an la ilaha illallah. أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
They were just doing a follow-up asking, so if they go to the districts, they're getting support there, but they also get additional support through medical insurance.
It depends on if the child has a medical diagnosis. So if they're getting those services, like I said, medical diagnosis and an IEP are completely different. Some kids have both, but they would need to be evaluated so they can go to their pediatrician and ask, tell them their concerns and get a autism evaluation, a medical autism evaluation. So I know CHOC does them. There are other hospitals that do it too. So look into that if they haven't already done that. If they've already done that, then they probably have already been offered everything that they can offer through the medical insurance. But getting the diagnosis can help with getting those services because a lot of insurance companies require that to be able to have access to private speech or private occupational therapy or whatever it is that the child needs. They want to see that diagnosis or that they were evaluated by a medical professional. So the IEP wouldn't be enough to provide that.
So I'll add just a little bit, but taking a copy of the IEP to your pediatrician and showing them the services really helps. So, and then that it supports when you share that your child, there's a concern about your child and the school is providing the services. So it supports your case to, through insurance also, to provide services. And also there's one myth that parents, again, as Ayesha had mentioned, that letting kids receive services, that special ed, speech therapy is part of special ed, but it does not mean the child is put in a special day class. This year, my whole caseload from TK to 6 to high school are students based in general ed classrooms. So it's not just specific to more severely handicapped students. Gen ed students have needs. Again, stigma in our communities about having those needs or having a child on an IEP, it never shows up on their diploma. They do not graduate with that. The sooner your child has those services, and I like to say they graduate out of speech or OT, and they can be more successful. So please do not deny your children those services. Let them have that, and it does not show up anywhere on their diploma when they graduate from high school.
Thank you very much.
You're welcome.
Okay, inshallah, thank you both for such an amazing presentation. As a student, I found that very, very helpful to learn about. And inshallah, we'll be possibly sending those PowerPoint slides out to you guys. If you guys are new to the the IIOC special chapter, we do a lot of events for families, adults, children, just anyone who needs any, special accommodation or has any disabilities, we do events for them. So if you're interested in volunteering, working with us, planning events, or even just attending, if you know someone who could benefit from such a resource, please send them our way. And inshallah, please come meet with me so I can get your contact information, just because I don't believe we have a registration form. So just please check in with me before you head out. I would love to meet you, and thank you so much for coming.
Awesome, thank you.
Thank you for coming and
Thank
sitting
you.
and listening to us. I think it was